creating the ideal health kit for living on the land and off-grid, an allopathic emergency kit, options for basic surgery and protection, presented by Shenpen Rinpoche, hosted by Anthony Lovich. If you like this video, please click like and subscribe. This is ConsciousEarthAlliance.com.
It's a little bit funny, amusing for me to present the allopathic kit, since I am very much actually engaged into natural medicine and producing ourselves some of it. But I have been for 10 years, about 10 years, 15 years, responsible of a dispensary in the south of India in the Tibetan refugees camp. And although I was using also some herbal medicine and homeopathic medicine at times, when we find ourselves in some emergency situation, we need to use some quick acting medicine. I am actually quite convinced of Besham theory, rather. I don't follow, never believed in what pastor said or claimed. But it is true that from time to time we find ourselves in front of patients who are depleted in minerals, vitamin, and have a very bad terrain, and we need to use some quicker, let's say, therapy. And not everybody believed Besham neither, so we need to have some medicine also to address their issues. I would cover two fields actually: how to make a medical kit to have with you, either if you live off-grid on the longer term, or if you are going off-trail for walking or spending some holidays in places where you don't have access to a doctor. It should be clear also that I am not a doctor. Yes, I have a training from the Faculté des Sciences de la Santé of Health Sciences in Paris from the 80s, which gave me some background and some basis for the humanitarian activities later on. And then I learned a lot by practice, by being alone in a camp with 6,000 7,000 Tibetans and Indians, and I had to learn a lot on my own. So here we are not talking about daily situation where we have access to a doctor or where we have access to a hospital. Yes, in this case, whatever we have, it is better to address or to contact a doctor or a medical expert. But it happens we can be far away and encounter either some infections or some accidents. And in this case, what do we do? If or when we will face also some situation in our world when the medical system will not be accessible anymore or will collapse by any means, then we need also to react ourselves. So I would encourage indeed everyone to have a kit to survive and to treat oneself or treat the family in these cases. It is good to have a bag. So I would show a little bit just the bag that I have, in which we can place everything. All the equipment we have, all the medicines we need, something which is easy to grab, easy to carry, because this one can be taken as a backpack and it has a lot of rooms. So try to have something like this in which you can place the medicine that we will talk about, or any other medicine you would like to take with you. Either allopathic medicine or essential oil. Nobody talked about Gemmotherapy. It is not the time that I would talk about it, but though it is a very efficient, cheap and easy to produce medicine. So if we come to talk about medicine, and to make it short, because we are not doctor, and we cannot use medicines or antibiotics which are too strong, which have too strong side effects. If I would come down to one antibiotic, I would use augmentin. Augmentin, there are other names, of course. It is composed of amoxicillin and clavulanic acid. So if I choose this antibiotic, it's because it's a broad spectrum activity. It can address most of the usual infection. We can have, of course, other type of antibiotics according to either it is urinary infections or bone infection and so on. But augmentin is quite efficient for many cases, most cases probably that we would encounter. The second I would advise to have always at reach is aspirin. Yes, aspirin rather than Doliprane. Nowadays we hear a lot about Doliprane, which is acetaminophen. It has a lot of side effects, and it is hepatotoxic. So if we try to preserve our terrain and keep a strong energy to fight whatever we need to, I would not recommend Doliprane at all in, I would say, most circumstances. Aspirin can cover a wide range of needs, from against the fever, antipyretic, anti-inflammatory, and of course antalgic, so against pain. Of course, we should know that this medicine should not be used in case we are afraid of bleeding. So any surgery ahead, or any surgery ahead, or menstruations, or in any form of bleeding, of course, this should not be used. But otherwise, it's good to have. Yes, I'm sorry to mention some brand name. Maybe sometime it is more easy to refer to them. Given the circumstance, also, I would include one medicine which I didn't have at the time, but which appears to be quite effective for a wide range of infection and inconvenience, is ivermectin. This also, I don't know if it is the brand name or the name, but everybody will know what I'm talking about. Ivermectin, along with Artemisia annua, is very good against viral infections, and it has proven to be very effective against COVID-19 and its different variants. Hydrogen peroxide, always to have at hand also for several situations, from mouth sores, gingivitis, and all outside wounds, scratches, because hydrogen peroxide, for example, is very efficient against tetanus germ. The germ which causes tetanus is sensitive to it. So it's good to start to clean a wound with hydrogen peroxide. And to once it has been cleaned with hydrogen peroxide, then you clean it with, so if I don't use brand name, it is polyvidone iodine. I'm sure that most of you would recognize more betadine, for example. It has different form as a soap to wash a sore or to wash the place that you intend to operate if ever needed. It has a skin version for usual sore, and it has a mouthwash as well with polyvidone iodine. So always have polyvidone iodine at reach, because it is excellent against infection. It is excellent against fungus. So yes. In the kit, I would always also have an eye solution, washing solution, in case of dust, in case of gas, to be able to really clean the eyes. After, it depends who will take care of this medical kit. If it is somebody who has a good training, medical training, then I would add some more. For example, something to make anesthesia, even general anesthesia. There are some medicine which are not complicated to use and can knock down somebody for 15 minutes, even by intramuscular injection. I'm talking about ketamine, for example. But it requires, of course, to be a little bit more expert in the use of it. But remember maybe the name of ketamine if ever you need to prepare something for off-grid of a long period of time. So this is most of what I would recommend as a medicine. Then there is two other things that we need to take in consideration. One is the IV kit. So to get a quick infusion of liquid in case of severe dehydration, or in case of bleeding, severe bleeding, or if we need to pass some medicine or some antibiotics over a certain period of time. So to have IV way. So for this, we need the needle, we need the tubing, and we need two bottles. One bottle which is NaCl, so basically just salted water, and another one which is called G5, which is glucose 5%. Each of them having their own use according to the situation. But they are good to have at hand. And if you don't know much how to place it, maybe somebody in your surrounding will be able to do that. And then we need to have what I guess we call in English a tourniquet, yeah, something to stop heavy bleeding. There are different type of device, and I would recommend one particular which is called CAT, which stands for Combat Application Tourniquet. And if you want to buy the latest one, I think is this Gen 7, so seventh generation of CAT tourniquet. So I have this also because we never know what can happen in case of accident. If you need to stop a heavy bleeding, you need a heavy material. It's sometimes difficult to stop a heavy bleeding just with a rope or a belt. So you need something which is a little bit more efficient. If you are ever to use a tourniquet, always, and I mean always, write the time you place it. So if you have a tourniquet, you need to have a sticker or a paper and a pencil. Why? Because if you place a tourniquet for too long time, the whole member will need to be taken away after 20, 25, 30 minutes. So regularly, it is important to release some blood for the circulation, even if it bleeds. Okay, it can bleed a little bit, but you need to bring blood for the rest of the member, of the limb. Yes. So tourniquet with a pencil and a paper. I would have also what we call hemostatic clamp, which are little pins which can help to close or to clamp blood vessels in case of severe injury. And this can be done by anybody who doesn't faint with blood, of course, but anybody who can recognize a blood vessel can use hemostatic clamp. An eye pad, in case you need to cover the eye and you need to put the eye at rest. Gauze pad, of course, for the cleaning of the wound, which goes with adhesive pads, bandages. There is also one thing we don't always think about. It is called the emergency trauma dressing. It's a little kit you can find on internet. It has two versions, the usual version of the trauma dressing kit and the abdominal emergency trauma dressing kit, which is a little bit larger, and in case of a large wound or severe wound of the abdomen. especially if the guts are coming out or something like this. An emergency blanket, of course, you know, this kind of very thin foil, gold on one side and silver on the other side. It is useful to keep the temperature of somebody, especially who is in shock, who is going into shock and needs to be kept warm, even if the surrounding is not so much warm. Of course, after you put inside all the smaller things that we know, like the band-aids and this small adhesive tape, you will place also in your emergency kit what we call rehydration kit, rehydration salt, which can be drinking by somebody who is going into dehydration because of the sun or because of strong activity, too strong activity, and so on. You might find also useful to have what we call CPR face shield, which is if you need to give mouth-to-mouth breathing to somebody who is who fainted, who is in a cardiovascular arrest, and the person has blood or has you know, saliva or whatever to protect yourself. This is called CPR face shield. If you know a little bit more about first aids, it is good to have also the cannula, which maintains the airways open. You try to have a blood pressure kit, you know, blood pressure device. Better to have the manual one that you need to pump, but you need to learn how to use it, of course. Why? Because you don't need battery, and battery have a certain lifespan. So beside this lifespan, how do you take the blood pressure? So you need to have this manual one. It is better. I would also consider to have what we call a suture kit or stitching kit. If you are not afraid of the blood, for example, you might need to repair a wound. It's not complicated. It can be learned. If ever you learn how to stitch a blanket or stitch a cloth or whatever, you can learn how to stitch the skin as well. It's different, of course, and it requires to learn how to make some special knots so that your thread does not open. I mean, the wound does not open, but it is good. I don't know if I go through the list of this suture kit. I'm sure that online you can find them ready-made with enough needles and clamps and scalpel hand, how do we call scalpel blade and scalpel handle to address most of the common injury you can find. Sometimes we just need 2 stitches. It's not difficult to make. 2 stitches can be made even without local anesthesia, and it can help the wound to do not get infected. So you clean well the wounds before, of course, hydrogen peroxide, polyvidone iodine, you dry up, and then you make your stitches. So this, what I mentioned as a material or as medicine, can enter into a small pack. You don't need a big pack like behind, which has more bandages and more material. And it is something that you can take with you if you go for some time a little bit off grid. I would like just to add one thing which is not allopathic, but which is connected with my current activity. It is macerates, which is buds macerates. We call this Gemmotherapy. The bud macerate is buds which are placed into a solution made out of water, alcohol, and glycerin. And so it is quite easy to make. The maceration lasts 4 weeks, and at the end you have a very efficient medicine. And among all the different type of macerates that we are making, one I would advise particularly, it is black currant maceration of the bud. Why? because it is a very powerful anti-inflammatory. And inflammation is something that occurs in a wide range of pathology or infection or even wounds, because it can be placed on the skin as well. So I would add this black currant macerate into this allopathic kit. Yes, I saw passing that because I mentioned Doliprane. Yes, it is paracetamol, of course. So paracetamol or acetaminophen. I would not take much of it, except in the cases where the aspirin cannot be taken, and aspirin is acetyl salicylic. Voila. I hope I entered everything into the time allowed for this this explanation. If there is any question, of course, I can answer, and I can send my little paper to whoever would find interest in it.
Thank you very much, Rinpoche. That was very enlightening, and it's very important to get the balance between all these alternative forms of medicine, and that idea of a pack which you can snatch to go to an emergency. I see reflected in another fine institution, Médicinales Sans Frontières. And so we can make up that pack using our experience. I did put in the chat, it's very important, I think, for people living off grid to try and get some education from books such as, I have a couple here, the SAS Urban Survival Handbook. So it's designed for soldiers, but of course they are in extreme conditions, similar to what we might find in an off-grid situation.
I also have a question for Rinpoche, and it was regarding antibiotics. I'm not sure if you did mention like accessibility to them. Of course, we're used to getting them from doctors with a prescription. Can you speak to that issue?
Yes, most of the time you get a prescription from the doctor. So if you have a doctor at hand or who can understand that you are going to travel or you are going somewhere where it will not be so easy to get the medicine, then he might do a prescription. I mean, not for free, but in advance, let's say, even if you don't have an infection. There are other ways, but which we should be a little bit cautious about. It is to buy the medicine for the animals. Most of the time, the medicine which are prescribed by the vet are the same as for the humans, and you can get them without prescriptions. So amoxicillin, for example, or penicillin, it is quite common to get for the animals. But you need to be careful that there is no excipients, there is no additive which are specific to animals. Yes, there are some countries where it is also possible to get them quite easily. And the whole time that I spent in India taking care of the dispensary, I never had a doctor close by to make a prescription. Even the anesthetic, the ketamine, Ketalar, I could buy directly from the pharmacy. Maybe not all pharmacy do that, but the relationship that I established with some pharmacy in Mysore, the close by city, they deliver it to me quite easily. So it might depend from one country to another. And this is about the antibiotics. I think everything else I mentioned can be obtained over the counter.
Yes, thank you very much, Rinpoche. And I think Radha emphasized the importance of nutrition. And of course, it's our self-responsibility to try not to get into the situation where we're having to apply antibiotics. And there are some herbal antibiotics, so-called. And also there are kits. of homeopathic remedies. I know that in England there's a company called Helios. Helios is, it supplies a shop which I'm involved in, Food for All. We can dispense them without any kind of license. And there are emergency kits prepared to be taken away. And they usually include a sheet of tips on how to be using them and the kind of situations you would use them in. Of course, it's best to have a homeopath within ear's reach or on the telephone if you're unsure, because it's a different method. It's not addressing the a disease as such, but as the constitution of the individual. So all these wonderful wisdoms are available, and I think it's best if we try our level best to educate ourselves in any of these that we feel is in tune with our way of life.
I would like, if it's possible, to add one thing to close the topic of antibiotics. Is to have some yeast or probiotics with yourself. If ever you need to take antibiotics, we know that they will destroy a part of your symbiome, yes, the gut's flora. So it is important to restore this gut flora as soon as possible, because it is a very important part of our health. Never take the probiotic at the same time of the antibiotics, of course, because then otherwise it will be destroyed before it reaches your gut. But maybe if we have the antibiotics, and we need to have also the contra effect of the antibiotics on the intestinal flora. Somebody mentioned in the chat that her son had a strong allergy to amoxicillin. To everything, anyone can have an allergy. We had amoxicillin. I mentioned the aspirin or acetyl salicylic acid, or even polyvidonyl. There are people allergic. We cannot prevent this allergy. Most of the time, fortunately, there are minor allergies, skin rashes, and such. Rarely you have an anaphylactic shock. It can happen, yes, but
yes, I think even with herbal remedies, there can be reactions. But as a mutual friend of ours, Susie, said to me, the worst thing that can happen with herbal medicine is that you'll throw up. And that's no bad thing, because your body wants to get rid of something, it'll find a way. And if we can assist that process, it's not a bad thing. People such as myself have had mucus for the last 3 weeks. But when we regard the body as a temple, and that temple has to be swept out occasionally, then you view things in a different way. So I appreciate all those hints, comments, wisdoms, and we appreciate the years of study that you've put in to convey this information to us.